Pharmacology. So this is basic pharmacology. For a lot of you guys, this will be review. So let's test and see what you guys were able to retain. What's important is for you guys to get the terminology down. All right, so make sure you ask the patient all their current meds, including supplements. Somebody name me a supplement. Yeah, your vitamins. So what's the other supplement with vitamins?
Minerals?
Yeah, minerals, vitamins and minerals. So those are supplements as well. And then some places they take a lot of herbs as well. So ask them about those supplements. Recreational drugs. And then for the MA, patient education. Can a pharmacy technician counsel patient on drugs?
No.
No. Can an MA? Within their scope of practice. All right, so what's your role with pharmacology? Well, let's see what they say. Aware of all meds, OTCs, alcohol's effect, recreational drugs. I mentioned supplements, so your vitamins and minerals. And then, of course, always relay this information to who?
Patient.
And the practitioner. Very good. All right, we got some pharmacy terms. Pharmacognosy. So that is the study of pretty much natural plant sources of drugs. So we can just remember sources. Pharmacodynamics. The D is for what the drugs do. So this is what the drugs do to your body. So just look for the D. And then pharmacokinetics is what you do to the drug. So if you guys recall, that is absorption. And we'll go over these again. Absorption, distribution, metabolism, and excretion. Therapeutic effects of drugs, so the beneficial effects of drugs. And then toxicology are the poisonous effects of drugs. All right, let's talk about the sources. So pharmacognosy is just basically the study of natural sources. That's all you have to really remember for that one. Pharmacodynamics, what is that, guys?
What the drugs do.
Yeah, so what the drugs do to your body. So if they block receptors, then they're usually going to be a anti-drug, right? Like an antihistamine. What do antihistamines block?
Histamine.
Histamine, there you go. Right? So that's what the drugs do to your body. Pharmacokinetics, that is what your body does to the drug. So our body will absorb the drug, so get it into the blood. It will then take it to the site of action once it's in the blood, distribution. And then in the liver, the drug will be changed by our body. And then our kidneys will excrete the byproducts. Right? So that is ADME, pharmacokinetics, what our body does to the drug. Absorption. So we can manipulate absorption based on manipulating the dosage form and route. So that's how fast it gets into the blood and how much of the drug gets into the blood. Distribution. Once the drug is in the blood, it needs to get to the site of action. The drug does not work unless it interacts with the site of action. Where does metabolism occur?
In the body?
Liver. Right. So that is our main metabolic center. So the liver is just a bunch of enzyme producing cells. What's an enzyme?
Stuff that
it breaks down other stuff.
Yeah. So it's the workers. It's the workers in the liver that changes the drug. So we got a drug. The enzyme will break it into its byproducts. Right? E and F. Right? Those are the byproducts, aka metabolites, the breakdown products. And then what happens to these metabolites in your kidneys?
The filter?
Yeah, the kidneys will filter out those metabolites and will excrete it. So elimination is the function of the liver and the kidneys together. So it's metabolism and excretion. So make sure you remember that. Elimination is both these processes, metabolism and excretion. So you got two E terms there that you might mix up or interchange them. So just be careful. Pharmacotherapeutics, efficacy. Efficacy is the fancy term for how effective a drug is. So for drugs, how effective it is its efficacy. So a drug needs to work. Indication is the purpose of the drug, so what it is used for. Now that purpose is stated on the label. So when a doctor writes a prescription that it's in accordance with the labeling, then that's okay. But there's also off-labeling uses of drugs. So a doctor with their expertise and their knowledge of drugs, they can have off-label use in the forms of compounds. So a doctor can still make custom drugs, and a pharmacy can mix them up in different forms, different dosage forms in compounding. But manufacturers, they can only advertise the indicated use of their drug, because that's the only thing they did in their clinical research. So also in clinical research, they'll take a look at the side effects and adverse reactions. So if you ever seen an ad for drugs, towards the end, they start talking really, really fast, and they list off a bunch of side effects, like dry mouth, laziness, dizziness, drowsiness, and in rare cases, sudden death. Right? They always sneak that one in at the end. Toxicology. So you know the poisonous effects of a drug, then you can know the antidote for the drugs. So a common toxic agent is this guy. What is APAP? Tylenol. Right? A lot of drugs contain Tylenol. A lot of your cold and flu medication contains Tylenol. A lot of your pain medication contains Tylenol. So patients might mistakenly take too much Tylenol. So what's the antidote for too much acetaminophen?
Anti-acetaminophen.
Okay, so good, charcoal. So you guys know what charcoal is for, right? Do you guys know what charcoal is? So it's carbon. It's carbon with a bunch of holes in it. Now charcoal only works if you have not absorbed the poison. So what charcoal does is tries to trap the poison while it's still in your GI tract. So if you ever heard the term activated charcoal or charcoal with sorbitol, that's trying to get that poison or drug before it enters the bloodstream. Right. So you just poop it out, and then hopefully it never enters. But if it does enter, then you'll need the antidote. So the antidote for Tylenol is?
Charcoal.
No. Do you guys have a question?
Yes. So what's the difference in the one that you said you'll poop it out, but there's one that makes you throw it up?
Okay, yeah, that's the same thing. So when you ingest certain things, sometimes it says not to induce vomiting, and sometimes it says to induce vomiting. So when do you make them throw up, and when don't you make them throw up? So if it burns on the way down, guess what happens?
It burns coming up.
It's going to burn on the way up. So if you give somebody something super acid or super basic, like battery acid, for example, then you might want to neutralize it, because if you make them throw up, it might now get in their nose and then burn that as well. Right? So that's one way, but always contact poison control and try to get the exact chemical or packaging so you can relay that information to them. So they know. If they know the chemical, they know the antidote, they know the treatment.
Does the charcoal expire?
Really, it doesn't. Manufacturers, by law, they just have to put an expiration date on it. But as long as it's stored properly, it's pretty much stable. Yeah.
So with the charcoal itself, is there like a time lapse when not to use it?
Yeah. I mean, if it's already in the system, then it's almost pointless
Because
to give it, but they might.
example, I found out that I took some ibuprofen years ago, and within 45 minutes, everything's shut down. Like I'm closing up.
Okay.
Well, they rushed me to the hospital, and they just start pumping like just adrenaline to get me going, right?
Mhm.
So that was good. Well, then I didn't know what it was. Well, then a week later, I wound up taking the ibuprofen again, and within like 15, 20 minutes, the same side effects, the symptoms were happening. So I went straight to the hospital, and then they pumped in. They made me drink the charcoal stuff.
Okay.
So
Okay.
it's with that, it wouldn't have helped out the first time around because it was, I guess it was too late.
Yeah, it's already in your blood. Yeah, that first time you said you were taking it all day, and it's
No,
been a
I
while.
took it one time, and it was like God, and I had a headache, and within 45 minutes, I just went downhill. But the second time around, it happened so fast, it was within like 15 minutes.
Okay.
The same side effects, symptoms happen.
Yeah, so they just predicted if it's already in your blood or not. So probably the first time a little bit longer time has elapsed. So they said, it's pointless. It's already in his blood. He already metabolized a lot of it. The second time, since the reaction was quicker and you got medical attention quicker, they said, hey, why not? It might still be in the GI system.
What's the antidote for
Antidote for Tylenol is mucimus. Anybody interested in RT? RT, respiratory therapy? So mucimus breaks up mucus. So when you are bedridden, sometimes you have really thick mucus. Have you guys ever been sick and then you're like, and then this super thick stuff comes out?
Yeah.
Imagine being bedridden or unconscious and all that thick mucus builds up. So the respiratory therapist will put that mucus down their lungs to break up the mucus, and then they'll need to aspirate it. They'll need to use suction to suck it out. So if you want to be an RT, you know that, hey, grab the mucus, and instead of putting it in the patient's lungs for a Tylenol overdose, they're going to have to take it by mouth, like a little bit every hour, until their kidney function is returned, or sorry, their liver function returned. Patient education. So very important. You inform the physician of all those drugs, allergies, food allergies, side effects. No, if I go back, it'll erase everything. All right, so reviewing the terms. Pharmacognosy is just the source, just focus on the source. Pharmacodynamics is what the drugs do to your body. Pharmacokinetics is A. What does A stand for?
Absorption.
D stands for distribution. M is metabolism. And E is excretion. What is M and E together? Elimination. Very good. And then lastly, pharmacotherapeutics. The therapeutic effects of drugs. And we just talked about toxicology. So if you know how a poison works, you will know how to treat it. You know how to counter its effects. All right, which of the following is study of poisons? C. Or do they go pharmacokinetics first? Oh, no, they go that way. Study of what the body does to drugs.
A.
What the body does to drugs.
A.
What the body does to
A.
drugs.
Dynamics.
Oh,
A.
no, it's pharmacokinetics. It's
What the body does.
A.
Oh, careful. So why is it A? Because it's what the body does to the drug, right?
Kinetics. K.
Used to prevent, diagnose, or treat.
D.
No. By definition, that is a drug. Study of what drugs do to the body. That is
That is E.
now. It's dynamics, right? Tricky, right? So they went with your psyche. They went with how you function psychologically. Study of how drugs are used to treat disease.
D.
Yeah, so you got to think critically. Don't just go with the crowd or what sounds familiar. And lastly, sources. Drug names. So we got the chemical name, big old long name. Right? So you guys remember the chemical name for APAP? Aceto, para, amino, phenol. Oh yeah, no, not that one. So that's the chemical name. No one remembers the chemical name. But what's the generic name? Acetaminophen. And then what is the trade name? Tylenol. So what's the easiest one to use? Tylenol. So that is the brand, aka trade name, proprietary, trademark, registered. Generic name is official under USAN. So that's the United States Council. So they make the official generic name. So everyone knows that if you say acetaminophen, that's the same chemical as APAP. OTC, do you need a prescription?
No.
No. Prescription drugs require RX only, so prescription only. For pregnancy, if you have an A category, is it okay to take during pregnancy? Yeah. Yeah. A is okay. A means all the studies says, yeah, it's fine. If pregnancy is B category, is it okay to take in pregnancy?
Yes.
Yes or no?
Yes.
So don't make my voice change you. But yeah, it is okay to take during pregnancy. Don't let me sway you. So yeah, but we haven't done any studies. But everybody who uses it is okay. So yeah, pretty much okay. C.
No.
Is C okay to use?
No.
C is, you're going to have some effects, right? But we know what they are. So you're going to have to balance the risks and reward with using that medication. How about this one? How about X?
Probably not a good idea.
Is X okay? Yeah, X is DED dead. So stick with A, B, and C. You'll be okay. But always refer to who? Doctor, pharmacist. They will know which combination, which drug, which condition. All right, not too bad. What are we doing today in lab?
Pin cutting.
1 ID, 1 S, and 1 IM, and then your lab reflection.
Is it one patient or different?
Oh, you can do it on one patient. It's easier if you do it on one patient. All right, guys, set up the lab, and you know which vials to use. Yeah, use the single dose vials. Thank you.
Ventral?
Yeah, I am. You can do either the deltoid or the ventral gluteal. Your pick.
Okay.
Shorts next week. Make sure you bring your shorts next week for the vatus lateralis.